And without further ado, I'll introduce our two speakers here. We have Hannah Farmer, and she provides personalized retirement benefits planning sessions to employees during one-on-one appointments, and she helps employees understand their options for retiring and all their benefits available to them. And Lucy Wells, she received a BS degree in pharmacy from UK and has extensive community pharmacy experience. She has served as the prescription benefit manager at UK since September 2008 and is the clinical director of the Know Your Rx Coalition since its inception in July 2011. She provides strategic direction, monitors clinical programs, optimizes cost management for the pharmacy benefits for each coalition participating employer covering approximately 160,000 people. So I'm going to start with Hannah.
Hi everyone, I'm Hannah Farmer. Is that a little better? Okay. So I'm one of the retirement officers here at UK, as Terry mentioned, and so is Terry. So if you would like to meet with Terry or myself, we would be happy to sit down with you and discuss all your benefits to more personalize it to you, because right now I'm just going to give you very general information and you're going to be like, I don't know where I fall in this group. Contact me. I'll be your best friend through this whole process. So let's kind of get started. So there's two types of retirements. There is early retirement and there is normal retirement. Early retirement is for anyone under the age of 65. And then normal retirement is anyone age 65 or older. And just so you know, if anyone hired on or after January 1 of 2006, there are no university health credits toward your benefits, or your health cost at least. So for early retirement, there are two requirements to be considered an early retiree from UK. First is your age plus your years of service must be equal to or greater than 75 with 15 years of continuous service. So there's two things. Age plus years of service, 75 or more, plus 15 years of continuous full-time service. So if you are a nurse and you're working 0.9, we will have to do a little service check to determine when you would reach your 15 years. For normal retirement, regardless of your years of service, you are eligible to retire at the age of 65. If you have your 15 years of continuous service, you will receive a health credit as long as you were hired before January 1 of 2006. If you have 5 years of continuous service, you will have access only to our plans. So for early retirement, it is recommended that you give a 90 days notice for retirement. For retirees, health premiums are eligible based on whether you're eligible to retire before July 1st of 2007 or after July 1st, 2007. And Terry and myself can determine those rates based on a service check. If you would like a service check, I'll be happy to complete one for you, as well as Terry would. And then for normal retirement, it is recommended you give a 30 days notice. So premiums and access determined by retirees' years of eligible, if you have 5 years or if you have 15 years, and whether you would receive a credit or not. So for early retirement, age plus your years of service must be equal to or greater than 75. And then premiums upon whether you are eligible to retire before 7/1 of 2007 or after 7/1 of 2007. So if you are eligible to retire before July 1 of 2007, as you can see for those rates for the HMO and the PPO, it is $81 a month just for yourself. So those are really good rates. If you're adding the spouse, it is $890. That is because spouses do not receive a health credit at the time of retirement. The RHP is $86 per month, and then the EPO is our Cadillac plan. It is $353 per month if you are eligible to retire before July 1st of 2007. All of these rates are located on our website, so you can check out the retiree booklet, or if you would like an actual book in hand, you can stop by our location at Export Street or Scoville, and we can provide you one of these booklets. For an early retirement, so if you are eligible to retire after July 1st of 2007, you're most likely going to fall into our age service matrix. So this is going to be your age plus your years of service, so where you would fall. So if you are under the age of 60, you had your 25 plus years of service, you're going to pay $325 per month for your health insurance. This is if you were hired before the July 1st of 2007 date, or January 1st, 2006. If you are adding a spouse, it is $809. So spouses, remember, do not receive a health credit. And then for the children, it is $404 per month. So if you're adding in the whole family, it is $1,219 per month. And then these are the costs for the RHP. Again, it's going to fall into your age and your years of service. So if you were 60 and you had your 15 years in, you're going to pay $614 per month for your health insurance. And then early retire for the EPO. So if you had your 25 plus years of service and you were less than 60, you are paying $434 per month. And again, all these rates are in the book. You are locked in at the matrix of which you retire. So if you were to retire less than 60 with 25 plus years of service, you pay that $434 a month. This is until you reach the age of 65. Well, you're locked in at that matrix. So the age service table for employees hired before January 1 of 2006 and that are eligible to retire after the July 1st of 2007, these are how our rates are determined. So when you're under the age of 60 and you're 25 plus years or more of service, you're paying 40% of the premium. If you're age 65 or older, you're only paying 10% of that premium. Currently, that rate is $33 a month for the carve-out. So for normal retirement, this allows for regular employees to retire at the age of 65 or older, regardless of years of service. To be eligible for the health credit, you must have your 15 years of continuous service in. To have access to our plan, you must have at least 5 years of continuous service, and Terry and myself can determine that. So for normal retirement, if you only have 0 to 4 years of service, you are not eligible for the UK health plans. If you have between 5 and 14 years, you have an access only, and then anything above that 15 years, as long as you were hired before January 1 of 2006, you will receive a health credit. If you're hired after, you would not. So going back to early retirees. So if you were hired after that January 1 of 2006, and you do not get that health credit, it's $809 per month. So for Medicare and your UK benefits, so age 65 or older, you must enroll in Part A and B. If you are still working, you just need to apply for Part A only. Terry and myself will help you apply for Part B when it comes time for your retirement. If your spouse is driving the bus on your health insurance, meaning they are taking the load of the health insurance, and you are still working, and or if you decide to retire and they are still working, you can actually go in their health plan to save on a little bit of money if you wish. So they are driving your health insurance cost. So for Part A, it is free. It's your hospital insurance. Part B is your medical insurance. There is a premium to it. Currently, it is $134 per month. If you are taking Social Security at the time, it will come out of your Social Security check. If you are not taking Social Security, they will bill you 3-month increments. Part C and D is covered currently by the UK Carveout plan. Part C is the Medicare Advantage plan, which we will be switching to effective January 1. So it's a private insurance. You can choose individual supplemental plans through BCBS, Anthem, United, and Healthcare. And then Part D is our prescriptions. And Lucy will talk about that in a second. She's the expert on this, so she knows all about it. So when billing on the UK Carve-Out plan, so UK, they're on the Part B, there is a deductible, and it's $183 on a calendar year, so January through December. Right now, you're kind of used to a fiscal year of July to June, but now we are on a calendar year for your health insurance. So there is that deductible. Currently, it's $183. We don't know 2019 yet. I have been looking daily on the Medicare website just to see what those rates are. But once Medicare lets us know, I can let you know. So after that deductible, Medicare pays 80%, UK is going to pay 80% of that 20% what Medicare doesn't cover. So on our carve-out, you're only paying 4% of the premium. You can go to any doctor that takes Medicare, and then Anthem currently will be your supplement. We call it the carve-out plan. And then you're going to owe the 4% after all that's been met. So the current cost for the carve-out plan, if you do receive a credit, it is $33 per month. If you are adding the spouse, it's $363 per month. So, remember, spouses do not receive a health credit. So if you are on a split plan to where you're over the age of 65 and your spouse is under the age of 65, the spouse will pay you that $809 and you would be paying the $33 since you're going on the Medicare plan. And then if you do not receive a credit for you and your spouse, since if you were hired after that January 1 of 2006 date, the cost is $660 per month. So we are going to switch to a Medicare Advantage plan effective January 1. It's a type of plan that's offered by a private company that's contracted with Medicare, as Hope was talking about prior to me. Medicare Advantage plan provides all of your Part A and your Part B benefits. And you must be enrolled in Part A and Part B to be eligible for the Medicare Advantage plan. For more information, will come out in mid-November. Right now we don't have any of the information, but be on the lookout if you are planning on retiring January 1 or after, and Terry and I would be happy to sit down and talk to you and discuss any of that information. So for normal retirees returning to work, so once you retire, you can return in a temporary non-benefits eligible position. Please let myself or Terry know you are coming back because you are eligible for a health credit for at least 1 year based on the Affordable Care Act. If you return immediately to work, there is a 1 year stability period to comply with the Affordable Care Act. This will allow for you to receive the employee rate for the benefits for you and your dependents. So you can pay the employee rate for 1 year just by working 20% FTE, which is roughly 8 hours per week on average. So after year 1, the working retiree rates would apply. So if you worked a 0.2 FTE or greater, employer sponsor insurance, HMO, PPO, EPO is your primary over Medicare. If you work a 19.99 FTE or less, there's no impact on, and you should enroll in Medicare Part A and B. So here are the rates. So if you were just by yourself, you're working 20% and it's year 2 of your working retiree position, you'd be paying $31 a month, which is great. It's your employee rate at the time. If you are adding your spouse, it does go up a little bit. It's $560 per month. So, which is still less than the age service matrix, because remember the spouse pays $809 and you're now paying $560 for the both of you. So we do offer phased retirement as well. This is administered through your department. You must have your 15 years of continuous service and be over the age of 60. There is an application on the line that needs to be completed. There are 5 signatures. One is mine, so that one's an easy one to get. And then the rest will be handled through your department, and we can kind of discuss that a little further. On phased retirement, it's anywhere between 50% and 80% FTE with a max of 3 years. So, and even after those 3 years, you could potentially come back as a working retiree, and as long as your department will allow it, though. So, while on phase, all benefits are the same cost. So you still get your life insurance, you still get your health insurance at the same cost, still accrue your sick and your vacation time. So it's a great plan we have here. And you continue to contribute to your mandatory retirement, but at a reduced salary. So if you were 100 reduced to 50%, you would receive 50% salary. You receive 50% going into your mandatory TDL and vacation time you would receive. But now you can access your retirement to subsidize that income, and to replace that income. So on phase retirement, you can check out our administrative regs for more information or contact Terry or myself. So remember, no less than 50% FTE and no more than 80% FTE is when you're on the phase retirement. It's not an absolute right to be granted a phase retirement since many department and positions may not be able to accommodate. And then here are some good reference points. So this will also be on our website as well, or you can contact myself or Terry. So, and then some good contact information. You got myself, so you can always call me, and then Terry or to Laura as well. She's any of the retirement officers. Todd, so wonderful speaker we had earlier, or Kara Tack if you have any issues about your billing once you get to that retirement stage. And then we have other contacts, Lucy Wells and Know Your RX, wonderful group we have here. Or if you have any billing or claim issues, here are those questions. If you have any claim issues whenever you're going on Medicare, Debbie Martin is your person. She's great. And then retirement counseling, TIA infidelity. We don't really discuss any finances whenever you're speaking with Terry or myself. So when it comes to finances, we leave it up to the professionals. So we'll contact TIA infidelity. They are available on campus. That list can be found on this website here or by going onto our website. And then next I'm going to talk, Lucy is going to talk about your prescriptions.
Well, I appreciate y'all hanging in there. I know I'm the last thing between you and your weekend, so kudos for hanging around. So I hope it's valuable information I can provide to you. I'm going to talk about your pharmacy benefit, and when you retire, depends on where you are. So if you're an early retiree, not yet Medicare eligible, your prescription benefit remains exactly the same as it was when you were working as an active employee. But when you are retired and turn 65 and are Medicare eligible, you do go into our Medicare benefit. It does require you to be enrolled in both Medicare Part A and B to be eligible for it because it is a Medicare Part D plan. So we'll kind of talk about this as we go through this. For the early retirees, the non-prescription Medicare benefit, like I say, is exactly the same as your current benefit. You'll still stay in the, the HMO, the PPO, whatever from your medical benefit. There is a universal prescription benefit, so it doesn't matter what medical plan you're in, your pharmacy benefit is the same. You might recognize the ID card. You should all have an Express Scripts prescription ID card in addition to your Anthem medical card, which is what your pharmacy uses to run the claims. Under this plan, just like when you're an active employee, if you have covered dependents, spouse, or children, they are all covered on that same card. We only list the subscriber on that, but it's one card, one ID number for the whole family. And then we kind of run the enrollment and the eligibility. So if something changes, you're adding a spouse, somebody's coming off your plan, or you're standing at the pharmacy and you just added somebody, you can call us up. We can go into the eligibility system, add them on the fly while you're standing at the pharmacy counter and get your prescription. That is different when you're in the Medicare world. The Medicare prescription benefit, like I say, it is a Part D plan. It is not, something that you're going to find out on Medicare.gov during Medicare open enrollment, because the only people who can then sign up for this plan are UK employees. So it is not available to the general public. Every person in the Medicare world is a subscriber. So, in the UK world, perhaps you and your spouse qualify for the benefit, and that's how you're going to be listed in UK databases, that so you're the retiree, you've got a covered spouse. You will each get your own Medicare prescription drug card with a unique ID number, because Medicare doesn't consider anybody to be a dependent. Everybody is a subscriber. When we do eligibility, this is something that has to run, we have to submit to Medicare for them to verify coverage, eligibility, that you are, A and B covered, your Medicare ID number matches, et cetera, et cetera. It takes about a week to get you enrolled. So if you're standing at the pharmacy counter and you were in the benefits office yesterday to sign up for a plan retroactive to October 1st, your prescription claim is not going to process. We can always work with you once your eligibility is retroactively enrolled to help you, get a refund. Sometimes we can do some things on, if you were covered on the commercial plan, to open that back up to let you get your prescription. But it is not, we don't control this. It does have to go through Medicare's eligibility engine. When you're on your active employee plan, this is the copay structure that you've had. It hasn't changed for several years. When you get a generic product, you pay a percentage co-insurance of 20% with an $8 minimum, $50 maximum at your retail pharmacy for a 30-day supply. For brands, you can see it's 40% with a minimum of 20, maximum of 60. And for a non-preferred brand, and for a 30-day supply, it's a $40 minimum, 50% co-insurance, $40 minimum, no maximum. When you get a 90-day supply on this is the active employee early retiree plan, there is a 10% co-insurance benefit if you get a 90-day supply. You are limited to a 90-day supply at UK retail pharmacies, so there are 5 of them. So Kentucky Clinic Pharmacy, there's one in Chandler Hospital, one in the University Health Building, and Turfland has one, and Good Samaritan has one. They can all fill 90-day supplies. Express Scripts Home Delivery can also fill 90-day supplies. So there can be some financial advantages for getting your maintenance medications in a 90-day supply from those facilities. But it is your minimums triple and your maximums only double. So I think people sometimes have in their head, if I get 3 months for 2 copays, that is sometimes true, not always. It depends on the cost of the medication. If you're on a higher cost brand, and granted most brands are higher cost, you do kind of get that benefit. Instead of being $60 a month, you would pay $120 for a 3-month supply. When you go to the Medicare world, I've kind of highlighted the things that are different. The percentage co-insurances by tier are similar, so 20%, 40%, 50% at your local pharmacy. There is no minimum on the generics, so sometimes your generic medications actually get lower cost when you move into the Medicare prescription benefit. The maximums stay the same. There are non-formulary drugs in the Medicare formulary. Medicare rules are a little different. The formulary that we use, there are some things that are just absolutely not covered. And so when you go into Medicare prescription benefit plan with UK, you should have a pharmacist from our office contacting you the month before. We actually look at your actual claims, and tell you what's going to be covered, what's not going to be covered, what can we do to fix it, are there alternatives or things you can appeal for. We'll make sure you've got your ID card, contact your pharmacy, make sure they've got the right number. When you're anticipating retirement, you can always call our office, have us look at your prescription, utilization, and kind of tell you where you're headed in advance so you can plan on that. You're also, the 90-day offerings are more expanded. You can get 90-day supplies at Walgreens, the UK pharmacies, and the Express Scripts Home Delivery when you move into the Medicare world. The 90-day supply copays are a little different, but the home delivery, that additional 10% per co-insurance discount for getting a 90-day supply, however, only applies Express Scripts Home Delivery. That is a Medicare rule. They only allow that to be designated as your home delivery pharmacy. A couple of things that change. We're going to compare the plans side by side. So I kind of mentioned here, when you're on the early retiree or the active employee plan, you can get a 90-day supply at a UK pharmacy or Express Scripts mail order. In the Medicare world, it's UK, Walgreens, and Express Scripts. Specialty medications, and I'll kind of describe these. If you watch the nightly news, you probably see 4 prescriptions for a specialty medication during a 30-minute broadcast. So it's the Humiras, the Enbrels, Taltz, Xeljanz. So you see all these commercials. When you're in the active employee and pre-65 retiree plan, you're limited to getting those at UK Specialty Pharmacy or at Accredo. When you're in the Medicare world, you can get it at any willing specialty participating pharmacy. So if Kroger's carries that specialty medication, you can get them there. There's no limits on that. Healthcare reform. So all the $0 copays that apply to preventive services, which you'll see on vaccines, smoking cessation products, oral contraception, which doesn't really hit this audience too much. All those are 0 copay. I'm trying to think there's other categories. Some aspirin in people over a certain age. Colonoscopy preps. That's more targeted for this group. Those are all 0 copay. When you go into the Medicare world, healthcare reform rules do not apply. So those 0 copays go away. So it's one thing I will advise people is if you're going to get a shingles vaccine, which unfortunately there's a shortage in the market right now, and I would advise everybody to do that. If you get it before you go into Medicare, it's free. If you go into a Medicare product, you will have a copay for that. So just keep that in mind. So some of these preventive things that are age appropriate, you know, under 65, you might want to get before you go into Medicare. Pharmacy copay cards. For most brand drugs that are out there, if you know, it might be your copay on UK plan is $60. Let's take Xarelto or Eliquis. You see those commercials too. They're anticoagulants. So if you've got atrial fib or you've had a blood clot, it's a $60 copay on our plan. There's a pharmaceutical copay card. So if you would go to www.xarelto.com or www.eliquis.com, you're going to be able to print off a copay card that acts as secondary insurance. It's going to take your copay down to about $5. They vary from plan to plan. Some of them go to $25, some of them take it to $0. You can use that when you're on the active employee plan. Medicare prescription Part D plans do not allow those to process. So that will go away if you're using those cards. And then the UK pharmacies do offer a 50% discount off your copay up to a maximum of $60 per prescription if your prescription is written by a UK prescriber. So if you're seeing a UK prescriber, you go to one of the UK pharmacies, they do discount your prescription up to 50% off our normal copay, maximum of $60. That also goes away when you go on the Medicare plan because it's a Medicare compliance issue. So there are some differences in how things work. Some coverage differences. If you're diabetic and you use diabetic testing supplies, currently, if you're in the active employee in the pre-65 plan, it goes on your same prescription benefit card. When you are on Medicare, those are Medicare Part B as in boy covered services. So currently, you would hand your pharmacy your red, white, and blue Medicare card, and they would bill those there. After we cross into 2019, it's going to go on your Medicare Advantage card. So that would be the card that you would present in 2019. Pharmacies should know that, okay? But, you know, sometimes you don't know to hand them a different card. Same thing is true. There are some other Medicare Part B covered drugs, some inhaled neb solutions, and I'm not talking like your little puffers, but if it's something you've got a nebulizer that looks like with steam and you breathe all that in, you're putting solutions in there, those are Part B covered drugs. Some medications after your anti-rejection medications after a Medicare coverage transplant, and some oral oncology medications. It's a pretty limited bucket, but those can also be Part B. And again, you would hand them your Medicare Advantage card or your red, white, and blue Medicare card. There are some Medicare Part D excluded categories, and this is by design. Medicare Part D does not cover vitamins and minerals, does not cover cough and cold. So currently they would not be covered in a Medicare world. I mentioned a little bit about shingles and hepatitis A because those are pretty topical right now. They would go, if you're an active employee or early retiree, those are all covered on either your prescription benefit, your Express Scripts prescription benefit card at the pharmacy, or they'd be covered medically on your Anthem, or your HMO, your PPO, your EPO plans. When you go into the Medicare, they are not covered on your medical benefit. So do not get those at your doctor's office. The only vaccines that are covered at your doctor's office when you go into Medicare are influenza, pneumococcal vaccine, and sometimes hepatitis B as in boy. It depends on why you're getting it. Everything else will go on your prescription benefit card, on your Medicare D card. And I already mentioned flu vaccine. So, as I mentioned, when you retire and you go on our retiree health plan and you're age 65, our plan is a Medicare Part D plan. October 15th, which is Monday, so from October 15th to December 7th is open enrollment for Medicare Part D. You're going to see commercials. You're going to see people set up in grocery stores and pharmacies everywhere trying to get you sign up. Do not sign up for another plan because your UK provided prescription benefit plan for retirees is a Part D plan. It happens every year. Somebody signs up for it. What it does, it kicks you off of your UK medical and prescription retiree health plan. We fix it, okay? It's because we get a report. I get a report every Monday from Medicare and tells me for whatever reason somebody's been disenrolled. The reason code is they signed up for another plan. So we call you and say, was this an intentional choice? Which is fine. You can choose to do that. But 9 times out of 10, people do not have any idea of the implications that they just lost their retiree health insurance. So we will get you reinstated. It's a whole lot easier if you don't do it going down the path the first time. It does happen sometimes in a long-term care setting too. Sometimes the facility will go along and just enroll their entire population in the same plan because it's easy for them. So something just to keep in mind. And we talked a little about the standard Medicare Part D benefit plan. This is what CMS has said, this is the least coverage a Medicare Part D can provide. You can't be any worse than this. Your UK benefit is better than this, but I want to show you some of these because some of the thresholds are important in some of the terminology. So for 2018, Medicare D plan can have a deductible up to $405, which means you would pay the full amount until that. Then you go into what's called an initial coverage period, where Medicare says in an initial coverage period, a member can't pay more than 25% of the cost of the drug. Then there's the infamous gap or the donut hole. The donut hole has been closing every year since 2006 when Medicare D was first introduced. And the goal was eventually to have the Medicare gap closed by 2020. Well, in the budget bill of this year that goes into place for 2019, it got closed. So it's gotten a lot better for the general public as well. It's still better for you and your UK plan. But the threshold is you enter the Medicare D coverage gap when there's $3,750 in total drug cost. That's not your out-of-pocket, that's the total cost of the drug. So what you pay, what UK pays. When that hits $3,750, you're actually in that donut hole. And then some things do change. So your cost share, it only gets better for you in a UK world because for 2018, it says the maximum co-insurance you can pay on a brand name drug is 35% in this tier. If you remember, some of our drugs had a 50% co-insurance. So if you're on one of those drugs with 50% co-insurance, it actually gets lower cost for you when you hit the coverage gap. The next tier then is called catastrophic coverage, and that's when your what's called your true out-of-pocket, and for 2018 it's $5,000. And don't go for a freak out. It's like I have to spend $5,000 before I get into the catastrophic phase. When you get there, your copays drop to no more than 5%. There are some other standards where it's $3.35 for a generic or $8.35 for a brand or 5%, whichever is greater. I'm going to explain this true out-of-pocket. You really don't have to spend that $5,000 because what we talked about where the pharmaceutical manufacturer has to contribute 50% of the cost of the drug in that coverage gap, what they contribute also counts towards your out-of-pocket. So you can fairly rapidly get through that coverage gap. Same thing on this slide, it just shows the 2019 levels. They do shift these a little bit every year, and as I mentioned, they close that gap. And so for 2019, the maximum anybody's going to pay for a brand name medication, the coverage gap's 25%. So, for friends and families and parents who are not in the UK plan, that's also a very positive thing for them because you may have experienced that where some medications get really costly in the gap. For the UK Medicare D plan, where we're different, there's no deductible. So from day one, you have covered benefits. You do have complete coverage through the Medicare gap, the donut hole. We don't change our percentage co-insurances there. Like I said, it can only get better. Our co-insurances are less than that required amount for the most part, but a brand name medication can get lower cost when you get to there. I did put where the thresholds change. We've kind of already talked about the difference between the coverage gap threshold and the catastrophic. It changes from $5,000 to $5,100 in 2019. And here's where I'm explaining the true out-of-pocket. So I'm going to give you an example of a drug that costs $3,000. And say you're in the initial coverage phase. And on the UK plan, your copay is likely a specialty drug. Your copay is like $60. So pharma contributes nothing when your initial coverage phase. You paid $60, so your true out-of-pocket credit is $60. Once you've moved into that coverage gap, we take the same $3,000 drug. You're still going to pay $60. Pharmaceutical manufacturer is going to contribute $1,500. So you get credit for $1,560 going towards your true out-of-pocket. So you can see after a couple of months in a medication like this, it is not going to take you long to get to that catastrophic phase where your copays really do drop significantly. And as far as rolling in the UK Medicare prescription drug plan, first off, you sign up for Medicare Parts A and B in advance of your 65th birthday. You will complete the Medicare Advantage and a prescription Medicare Rx enrollment form with HR Benefits Office. We send the files to Express Scripts, who sends on to Medicare for processing. And then when Medicare processes and approves, you will get a letter and a welcome packet with your ID card and 1,000 other pages of Medicare required documents that you will get. It gives you a lot of information with phone numbers to call if you need to appeal something, your explanation, your EOC, just a lot of information to hang on to. Starting in April of this year, Medicare did change their beneficiary ID numbers from being a Social Security-based number. So I don't know if it, it used to be it was almost your Medicare ID number that everything got billed on was most cases your Social Security number with either an A, a B, some other letter that indicated your status. As of April 2018, they have changed this. So by the time you get everybody hasn't been recarded yet, but for new enrollees, you're only getting this new number, and it's 11 random characters, numbers and letters, and it's this, it's this nice security standpoint because you're not throwing your Social Security number out there every time you file a claim. You will get, once you're in the Medicare D plan, you will get an explanation of benefits from Express Scripts via Medicare the month following any month where you had prescription activity. You didn't fill any medications, you won't get it. And I want to, it's not something you're getting currently if you're in an active employee plan, but you will start getting this. It does reference things like the initial coverage phase and your true out-of-pocket and catastrophic coverage. So I did kind of want you to know, because if it'll tell you, it will identify you when you're in the coverage gap or when you're a donut hole, and people always call, so I didn't think we had a donut hole. It's like, well, there is a donut hole because it's defined by your drug spend. Your coverage just doesn't get any worse in the donut hole. So it's also something with Medicare Part D called the late enrollment penalty. And what Medicare does is basically, if you don't sign up for a Medicare Part D plan when you are first eligible for Medicare and you didn't have other creditable coverage, then they will charge you a 1% of the Medicare standard premium per month you didn't enroll. And it's kind of like the same theory. It's like you can't wait till your house catches on fire and go down and buy fire insurance. So it's like you've got to have the coverage in place. If you are working for UK and you work until you're 68 years old and you've had our other health insurance that whole amount of time, UK will do the validation for you. We will attest to that you had coverage. If you've deferred your coverage, we often cannot do that, or you're coming from a different plan. It's a pretty easy process as long as you can document you are otherwise insured. But if you don't, you will, those penalties are incurred. And the 1%, it's like right now, the standard Part D premium has nothing to do with your UK premium. It's a Medicare National Standard premium. It's like $32.50 this year. So, for every month that you delayed, it'll be 32.5 cents, but times a year. And it will change on an annual basis because the Medicare standard premium next year is like, I forget what it is. It's not much different, but it's slightly different than the $32.50. But we, like I say, we will do that attestation on your behalf if you've been continuously employed with a university. It's also something called the income-related Medicare adjustment amount, and I think Russ referred to this earlier in the first presentation. This is something it's not forever. Late enrollment penalty is forever. If you incur a late enrollment penalty, you will pay that over the life of your Medicare participation. IRMAA is a year-to-year assessment, and it is income-based. So if your modified adjusted gross income from your 2 years ago income tax exceeds a certain threshold, you will pay, not your UK premium, but you will pay an additional amount to Social Security for the privilege of enrolling in a Part D plan. If you do not pay this, they will terminate your coverage. UK doesn't do it, Social Security Administration does it. It is a year-to-year assessment because it's based on your income tax from 2 years ago. So it can change. If you retired, you took a lump sum distribution or something, you might have a higher income and have to pay this 1 year. There are times that you can appeal this decision. If you can document that your income in the current year or the year is radically different than what they're basing it on, there are appeals forms that you can go through with Social Security. But there are additional fees that you may have to pay on a one-off year-to-year basis if your income exceeds certain thresholds. And there is an IRMAA for Part B as well. So if you're incurring this on Part B, you're also going to have the expectation that you will pay a separate income-related adjustment amount for Part D. Medicare Part D plans do offer an extra help, so people that have income below certain thresholds are eligible for additional help from Medicare. You get some premium reimbursement and also lower copays. The thresholds for this year are if you have up to $18,210 in yearly income or $24,690 if you're married, and up to $14,000 in resources, $28,150 for a married couple. Your resources include bank accounts, stocks, bonds, but it does not include your primary house, your car, your life insurance policies. So you can go to Social Security website. There's a little calculator you can do and answer some questions to see if you qualify for low income subsidy. This is one thing I throw into the Medicare world, and always it's kind of keep hoping it's a loophole that gets cleared up, and it may be something that you encounter with your parents now. It's something to be aware of. Because Medicare Part A covers hospitalizations, but it requires an admission. So if you go to the ER, you go for an outpatient surgery, and they keep you overnight for observation, you technically may not be admitted. You may have a room, and to all appearances, you had a hospital room, you were in a bed, you thought you were admitted, but your status has never been changed to admission. In that case, this is all Part B covered benefit. Medicare Part B in that setting does not cover drugs that are for self-administration. So you think about on a daily basis, you take your allergy medicine, you might take your Prilosec or something like that, maybe you use a nasal spray for allergies, whatever. Anything that they administer you that's for self-administration will be rejected when you get your bill, and they bill you for the full ride. And the full ride may not be so bad, except hospitals. The markup at hospitals is tremendous. We keep hoping somebody will figure this out. AARP is giving it a little attention, but so far it's still a problem. So, and I don't want to tell you if you go in the emergency room and you're in cardiac arrest, don't say, I don't want that pill because I don't want to pay for it. Do whatever they tell you if you're in an emergent situation. But there are times if you're going in for a planned procedure, a surgery, you can probably skip your Allegra. You can skip your statin for a day. Just be aware of it. You can negotiate sometimes. We do this sometimes. Some of the hospitals will negotiate down the rate. They're still going to charge you for it, but they won't charge as much. We can also help you submit for reimbursement on your pharmacy benefit, but you don't get anywhere near the dollars back that they've charged you. So it's just kind of something to be aware of. Take the things that are essential, things that are optional, you might want to pass by. So, and just, if I saw the table over here, who the heck is the Know Your Rx Coalition? Just in a nutshell, that is your UK Prescription Benefit Department. University of Kentucky started a pharmacy coalition in 2011. We manage pharmacy benefits for most of higher ed in Kentucky, the teachers' retirement system, the pre-65 retirees, and the Kentucky Employee Health Plan. So there's some synergies for purchasing to get a better deal on your pharmacy benefit, but it's also a lot of support from the pharmacists. We do, you're welcome to contact information on the table. Our numbers are here. You can call us anytime for information. We call you sometimes. So one of the things I've been working on during the day is where for Medicare, the changes that are going to happen for Medicare formulary for 2019. So we'll be contacting these people, the next month or two to let you know what's different for 2019 and what can we do about it. If it's negative for you, how can we fix it before you're standing at the pharmacy counter on January the 3rd with a surprise. So we do try to, give people heads up and mitigate any disruption to you or your pharmacy. So, and that, I just ended it. I didn't mean to do that. So we're available for questions if you have anything.
Oh, yes. She's got a question. For Lucy?
I killed there we go. Yes, go ahead. Okay. Well, you need to, and you can contact them and ask them for the detail. They have to give you detail. Yeah, she should be able to request that detail because for us to file, we need the detail, and we do it all the time for people. We assist it, but they need to provide you with the detail of what those drugs were, the quantities, and the individual charges. Yeah, I mean, she's still gonna be responsible for them, but she may be able to get some dollars back if she can file a claim for them. So, but just no, it wouldn't be. And you would have to call the skilled nursing facility and have them connect you to the pharmacy that provided those medications. Okay?
Where'd she go to?
There's two things. What's going to be offered in 2019 for your medical benefit is a Medicare Advantage plan, and that combines your parts A and B, so your hospitalization and your doctor's office and outpatient services. When you enroll in that, you also get this Medicare Part D prescription plan, all included in the same premium.
Yes, correct.
Anybody else? Yes. Cannot.
No.
No. And there are rules around HSAs if you have them too, and I don't profess to know that, but there are rules to that. So.